I'm going to talk to you a little bit about Headspace. It's a national youth service established in Shepparton in 2013 with federal funding. It's one of the many Headspace centres scattered throughout Australia, and the focus is on mental health, prevention and early intervention for young people 12 to 25 years old. So the prevention part, for example, if a young person is experiencing bullying, they may come into Headspace, and time is spent listening to the person, building skills and strategies to help them cope with that bullying, providing support, advocacy and education through programs such as Bully Busters, which the youth workers take out into schools, and also run programs at Headspace. Early intervention, addressing anxiety and depression if a young person is being bullied. So they're examples of prevention and early intervention, but we do provide holistic care to the whole person. So prevention and early intervention also applies to physical health, and which includes, of course, sexual health. That picture represents the many staff who work at Headspace. Some of those are core staff, and many of them are in-kind workers who come in, like Anna from Goulburn and Uniting Care. No, not Uniting Care anymore. So we've got youth-friendly and staff who provide free and confidential services for young people between the ages of 12 to 25 for mental health issues, general physical health and healthy eating, sexual health and sexuality issues, family and relationship issues, alcohol and drug issues, employment, education and training. And young people, they can drop in, they can call, come in with a friend, or they can ask a parent, GP or healthcare worker to refer them. So a young person may come into Headspace, they're not travelling very well at school, anxious about exams, and during the assessment process other issues may be identified. For example, they might be having unsafe sex, and they could also then be linked, well, they would also be linked in with the nurse, either myself or Suzanne Wallace, who's here today. They may be looking for a part-time job, and they may need help finding a job, help with writing a resume. We've got work trainers coming into Headspace as well, so they could be linked in there, and they may be linked in with other workers at Headspace as appropriate as well. So we, as I said before, it's holistic care, and if a young person is on a waiting list for psychotherapy, sometimes these things can be addressed first. So just a little bit about the sexual health information that I provide. A young person may come into Headspace and present wanting to see the nurse, and on assessment they may reveal they have been sexually active and very anxious that they might have an STI. During the conversation, information and education is given around STIs, in particular chlamydia, and the importance of testing every year when under 30 years of age, and explanation why this is so, because young people are usually more sexually active during that period of time, and also talking about how chlamydia is so easily treated. And also it's more easily treated now rather than later if that person develops PID, which is pelvic inflammatory disease. So that the young person gets lots of education around how important it is to test for chlamydia every year. And also there's a need to explain how it's necessary to contact sexual partners so they can be tested and treated as well. And show how easy it is to test, because it is really, really easy to test for chlamydia, and it's important that young people know this. Also, if they have a missed period, a pregnancy test with pre and post-pregnancy counselling, I'd also do that. And I'd also talk to them about PAP tests. Even though they may only be 16 at the time, they need to learn about PAP tests and how important it is to have PAP tests from the time they're 18 if they're sexually active, and also link them into other services as appropriate if any other needs are identified. It's important for me to link them in with the sexual health nurse practitioner if they're symptomatic, or if they need contraception. I also give them written handouts on the information I've discussed with them, and give them websites such as Family Planning Victoria and the Better Health channel. And of course condoms, they're always offered to the young person as well. So part of my role is health promotion, going out into the community, and I following conversations with Indigenous staff at ASH, I go to ASH on a regular basis. ASH is the Academy for Sport, Health and Education in Shepparton, for those people who don't know. So I usually go there for 1.5 hours every week. I've tried different approaches at ASH, aimed at building respect and trust by brief talks to groups, by mixing with students during their breaks, talking about headspace, what I do as a nurse at headspace. I'm provided with a room for consultations if that's needed. And at the moment I'm getting to know new students by sitting in classrooms and helping them with their schoolwork. The services I can provide at ASH are almost the same as I provide at Headspace. Obviously I don't do PAPs at ASH, but it's always important to protect privacy and confidentiality, and I do that by being very discreet in my approach if a young person requires follow-up. A phone call's sometimes best. So follow-up at ASH can be at ASH or at Headspace, depending on what the young person prefers. Other educational providers can access the Headspace Youth Health Nurse, that's me, via the website or via phone or an email, or they can come and have a chat with me at Headspace. Also at Headspace we have a community awareness officer. She raises awareness of Headspace in the community via talks to community organisations and schools, and via community events and specific Headspace events. She organised the Rock and Ride national event that you may have heard of, and she is organising at the moment the Man Up event about being there for your mates. And there's some information over there on the table about the Man Up event, which is on soon. She also coordinates the youth reference group that Georgie referred to in her talk, and she guides, directs, supports and mentors them. When communicating with young people and providing information and education around sexual health, it's important to communicate in ways that young people understand. Using simple language, allow interaction, encourage participation, like putting a condom on the demonstration penis, encourage young people to do that. Chlamydia activity in a group. There's an activity that we use where we put a glove on and we shake hands with young people, and whoever's got a glove on is protected from chlamydia. It's just a way of showing what a condom can do. So we reward participation, Headspace lollies, pens. It's important to thank young people for participating. Include the listeners who are too shy, thank them for watching and listening. So it's important to be inclusive and be empathetic to young people. Thank them for watching and listening. Be culturally sensitive. I've presented sex ed to young Muslim women at Headspace, and it's important to ask young women before demonstrating putting a condom on the demo penis if they want to see this. They did want to see it. One woman put her hand over her face and said, yes. She did want to see it, but she was a little bit frightened as well. So the Headspace Youth Reference Group, the young people apply to be in the group, and they get interviewed as if they're going for a job, and it's about them selling themselves about what they can bring to Headspace. They keep us accountable, and they make sure what we do is youth friendly and meet youth needs. It also gives young people a voice, and they also have input into Headspace programs. They research and evaluate Headspace services. I've presented to the group, the youth reference group, on my healthy eating talk. It got a tick, which is great. And they consult around resource development such as fact sheets, brochures, radio ads, etc. And they're involved in peer support and mentoring. And they help with events, manning headspace stalls, barbecues, and they're supported by the Community Awareness Officer. So I also take my service out into other youth settings. I go to Jacaranda. It's a youth residential service, part of the Mental Illness Fellowship. And I do talks. Tomorrow I'll be going, no, not tomorrow, next Thursday, next week, I'll be going and having a little bit of a needs analysis, I guess, with them just to see what they want to hear from me in the coming weeks. And I also go to ACE regularly. I go there each week. ACE is Adult and Community Education in Shepparton, and they give me a room there. And sometimes I go into the classrooms there and deliver talks as needed, and I'm also available there for an hour each week for one-on-one. So the strengths of this approach, it provides sexual health information and education where the young people are already connected. Young people meet workers to check them out for more sensitive issues like sexual and mental health, and embeds sexual health information and education into existing services and programs with follow-up care available. So while I am at these outreach services, I can do an intake for somebody who needs to come and have some care at Headspace if they're not travelling very well. So the keys to success: the service is free and accessible, it's youth-friendly, has a youth-friendly reception area, it's welcoming, a welcoming atmosphere throughout the client area, fruit and lollies on the counter, and of course condoms. The services are confidential and safe. We have friendly, welcoming, multi-skilled staff at Headspace, and it's a one-stop shop providing holistic health care. So that's my talk. Thank you.